I want to give you some snippets of a lecture from FMU, Functional Medicine University, so you have an idea of the high quality of the materials that you are provided. And so if you're interested in getting the full lecture and the link to that, please leave your information in the comments below so I can contact you or message me with your email. Thank you.
And some different novel therapeutics. Some learning objectives are to review some of the traditional as well as functional laboratory assessments for osteoporosis, look at some risk factors and prevention strategies for osteoporosis, colitis and inflammation. So it's really our job as functional nutrition practitioners to really dissect some of this information and educate our clients or patients with the appropriate care. So just looking at osteoporosis and defining it, it's a silent systemic bone disease, and that's what's really scary because it's asymptomatic. It's going to occur when the body loses too much bone, makes too little bone, or both. Also, you have porous bone, reduction in the mass and quality of bone. You have an increased risk of fracture, which can contribute to disability. And 1 in 2 women and 1 in 4 men over the ages of 50 years of age will suffer from an osteoporotic fracture. So it's not just women here. Men are equally, or about 25%. At risk. So when we look at the difference between healthy bone and osteoporosis, you can see it's really that you're losing a lot of collagen. And that's going to make up the majority of the non-mineral tissue of bone. And we're going to talk a little bit about collagen later, but collagen is going to form the matrix upon which the mineral portion of the bone accumulates, and that collagen is going to strengthen by cross-linking protein such as DPD, which is measured by their age. Then there's things that we may want to do from an intervention standpoint or therapeutics to make sure we're optimizing that. So a couple of studies I wanted to share. This was looking at the association of DHEA, sulfate, on bone mineral density. And essentially what they found is, this is 294 people, they found that there was a positive correlation between serum DHEA sulfate and femur bone mineral density, suggesting controlling this level may retard age-related bone mineral density reduction. And like I said before, and low impact weight-bearing exercises would be ideal. Light walking at least four hours a week. So light walking has been shown at 4 hours a week that can actually significantly reduce hip fracture. So it doesn't have to be someone powerlifting here. And then looking at elderly, so there can be, this population can have some issues with balance. So they may want to work with some sort of, personal trainer or physical therapist to do muscle strengthening as well as balance training. Salad greens, collards, and mustard. So I'm not going to, most of us are, or most of these patients are going to be more deficient in magnesium more so than calcium. So most of the formulations or the bone support products that I've used tend to have more of a 1-to-1 ratio of calcium to mag. And they're not typically at much higher doses than 400 in calcium. I mean, maybe 800 max if it's a bioavailable form. And then this was a study published, actually just a few months ago in nutrients, and they looked at different dietary patterns is significantly related to higher bone mineral density in older white women. And so this is just some references here. Several studies show significantly higher levels of bone mineral density in people receiving these supplementations. So again, this is just really there to support the importance of magnesium compared to healthy subjects, and they've revealed significantly lower amounts of zinc, copper, and manganese in these patients. Peptides and bone health, they're not all created equally, meaning that it's really important to have specific molecular weights that are going to signal for that tissue. And so this is kind of really just looking at the bone structure and the role of collagen. So you have your 70% of these inorganic minerals, mainly calcium phosphate, 20% of organic mineral, from which collagen type 1 is 95%. Increases intestinal permeability through a reduction of gap junction protein transcripts. This can also allow translocation of bacteria and increase antigens entering the epithelial mucosa. And this increase in gut permeability can be prevented by administering different types of probiotics. And then when you look at immune system modulation, it can reduce inflammation. So your TNF-alpha and your interleukin-6. And then looking at microbial products, short-chain fatty acids can directly influence bone metabolism by increasing trabecular volume, reducing osteoclastic differentiation, and bone resorption. The research that I see with either symbiotics using pre and probiotics, or multi-species, tend to have the best clinical outcomes over like the solo violinist. But at least here is one human clinical with a specific lactose strain that can be beneficial. So that's